So good morning all. Today we will discuss anti-thyroid drug. So first of all, we know to about what is T4 and T3, how T4 and T3 hormones will secrete and produce in our body. So there is thyroid follicular cell. These are responsible for the production and the secretions of the T4 and the T3 hormone. That is, T4 is known as thyroxine and T3 is known as triiodothyronine. So, with the help of follicular cell, T4 and T3 are produced. So, let us discuss how these are produced. So this is a follicular cell. So iodine will came in the follicular cell with the help of the sodium iodide sim powder. So when iodine will come into this follicular cell, it will convert into the iodinium ion. This ion, when iodine is converted into this iodinium ion, then the oxidation will occur. This is the first reaction. That is, the oxidation of the iodine will occur, and the iodinium ion will form. This iodinium ion will combine with the tyrosine, and they will form the MIT and DIT, that is mono and diiodotyrosine. This reaction is second reaction is known as organification, and after the formation of MIT and DIT, then there is a coupling reaction, that is a third reaction. In this, there is a formation of the T3 and the T4. MIT will combine with DIT to form the T3, and DIT will combine with DIT to form the T4. So in this way, the T3 and T4 are produced in follicular cell and stored in colloids. So whenever the so here is a three reaction occur for the formation of the T3 and the T4. The first one is the oxidation, second one is the organification, third one is the coupling. So so all the three reaction are catalyzed by the one enzyme, that is known as a thyroid peroxidase. So all the three reactions are carried by this enzyme, that is thyroid peroxidase. So when the T3 and the T4 are stored in the colloid, then after that, from the pituitary, TSH will come, and they will release the T3 and the T4 in the blood vessels. So remember, T4 always secrete more as compared to the T3. So but the T4 that is known as the thyroxine is long acting than the T3, but the T3 is the potent one. So here it is written that T4 is secreted more as compared to the T3. So but the T3 is the potent one as compared to the T4. So in the periphery, what happen when the T4 and the T3 will come in the blood vessel? Actually, we want T3 more. So what happen in the periphery? There is a conversion of the T3 from the T4 by the help of an enzyme 5-deiodinase. So this enzyme will help in the conversion of T4 into the T3. So this is how the T4 and the T3 will produce in our body and come in our blood. So next is in thyroid we have two conditions. Either our thyroid will be less, or either it will be a more. So first condition is a hypothyroidism, and the second one is a hyper one. So in the first one there is a less amount of a thyroid, and in the second one there is a more amount of a thyroid. The normal level of the T3 and the T4 in human body is 100 to 200 nanogram per deciliter, and T4 is 5 to 12 nanogram per deciliter. So in hypo one, so there is a less amount of a thyroid in our body. So basically we give this thyroid from the outside of our body. So either we have to give T4 and we have to give the T3, but we prefer the T4. Why we prefer the T4, that is thyroxine. We prefer T4 thyroxine because it is a long acting. But here is one condition, like in mixed edema coma, where we require the thyroid immediately, so we give the T3 because it is a potent one. Mixed edema is a condition in which there is a loss of a brain function. So this is about the hypothyroidism, in which we prefer the T4, that is thyroxine, more as compared to the T3, that is triiodothyronine, because it is a short acting and it is a long acting, and we need a long acting medication. So next drug for the thyroidism, in this there is a more amount of a thyroid in the body, so we have to decrease it to a normal level. So these are the drugs for the management of the hyper condition. In this, first category of drug is inhibition of hormone synthesis. So in this we have a drug like propyl thiouracil, methimazole, carbimazole, like drugs. So next is drug that inhibit iodide trapping. So in this we have a drug like thiocyanate perchlorate. Next is a drug that inhibit the hormone release. In this we have iodides of sodium and potassium, organic iodide. And the fourth one is drug that destroy the thyroid tissue. In this we use radioactive iodine, that is iodine 131, iodine 125, iodine 123. Next is so the next is drug inhibit the periphery conversion. Periphery conversion, that is the drug will inhibit the conversion of T4 into the T3, so that T3 will not produce. So in this category we have propyl thiouracil and the propranolol. Remember guys, propyl thiouracil has dual mechanism of action. First one is it will also inhibit the hormone synthesis, and second one it will inhibit the periphery conversion. So let's get discuss this drug one by one. So the drug in this category is first drug inhibit the hormone synthesis. So in this category drug is propyl thiouracil, methimazole, carbimazole. So so the mechanism of action of this drug is that it will inhibit the thyroid peroxidase enzyme. So all the three steps, that is oxidation, organification, and the coupling, will not occur, because this enzyme get inhibited. So this all the three reactions will stop, and the hormone will not synthesize. So methimazole is a active drug, and carbimazole is a prodrug which is converted into a methimazole. So this all points about the methimazole, that methimazole is a long acting drug, but it is not used in pregnancy, and it is a more potent drug as compared to the propyl thiouracil. Whereas on the other hand, propyl thiouracil is a short acting drug as compared to methimazole, but it is safe in pregnancy. It is used in pregnancy, and it is less potent drug as compared to the methimazole. And talking about the side effect of these two drugs, methimazole causes the skin rashes, agranulocytosis, and these drugs are teratogenic, not used in pregnancy. Whereas on the other hand, propyl thiouracil are used in the pregnancy, and the side effect of the propyl thiouracil is hepatotoxic drug. So this is about the first category of a drug that inhibit the hormone synthesis. Now the second category is drug inhibiting the iodide trapping. So in this category, drug is thiocyanates or perchlorates. So the mechanism of action of this drug is that it will inhibit the sodium iodide synthesis completely. So these drugs are normally not used because they are very toxic drug. They will inhibit the sodium iodide synthesis completely, so that these drugs are not very used. So next category of this drug include drug inhibit the hormone release. So in this category of drug include iodides of sodium and potassium, organic iodides, or a Lugol solution. So when we gave this drug to a hyperactive thyroid patient, then this drug by giving this drug, the hormone will not release, the hormone will secrete out, but hormone will not release. So after 9 to 10 days, then the hormone will escape from the colloid. Then this phenomena is known as a escape phenomena. This category of a drug is not used in the pregnancy. So the uses of this drug, it is used in the post-operative preparation, and this drug are also used in thyroid storm, or it is used in the prophylaxis of endemic goiter, and Lugol solution especially is used as a antiseptic. So side effect of this drug include it causes the inflammation of the mucous membrane, and it causes the rhinorrhea. So this is about the third category. Fourth one is the agent that destroy the thyroid gland. So in this, we use a radioactive iodine, that is iodine 131, iodine 125, iodine 123. So the mechanism of action of this drug, it behave like a normal iodine and entrap in the colloid. So after the entrapment in the colloid, they will emit the beta rays, which destroy the thyroid gland. So the T half of the iodine 131 is about the 8 days. So the advantage of using this drug is that their treatment with 131 iodine is simple and more conveniently, and no surgical risk, and the scar or an injury will occur, and there is a permanent cure by this drug. But this drug are not preferred in the younger patient. So these drugs are used in the grave disease and the toxic nodule or a toxic goiter. So these are the uses of this drug. Then comes the last drug, that the drug that inhibit the periphery conversion of the T3 from the T4. The T4 T3 will convert into T4 by the help of the 5D dehydrogenase enzyme. When the T4 and the T3 will come in the blood vessels, the T4 is converted into the T3 with the help of 5-dehydrogenase enzyme. So both this drug, that is propyl thiouracil, and the propranolol, that is a beta blocker. So both this drug will inhibit this enzyme, so T3 will not form. So this is the mechanism of action of these drugs. So this is all about the brief about antithyroid drugs. So thank you.